welcome, audience, to the Sylvatic Cycle Report. I have with me here Dr. Chanchal Bhattacharya, and you are a public health veterinarian working for the government of Delhi. Is that correct?
Yes, I was working with Government of Delhi. Right now, I'm heading Hyper International. Hyper International is Arkansas based organization. Okay, international organization. They are working in almost 23 countries, and right now, I'm their senior advisor, livestock technology and One Health.
Oh, that's pretty cool. And just so the audience can look it up, is it Haifa? How do you spell it?
Hyper, HEIFER, Hyper International.
Okay.
It's a very famous organization. Actually, it is based in Little Rock, Arkansas.
Well,
Okay.
I'm embarrassed that I haven't heard of it, but I'm definitely looking forward to learning more about what you guys are working on. Definitely. So yeah, this is my first time interviewing something, so I'm a little nervous, but
Don't get nervous. You
yeah,
you ask. Uh,
yeah, I asked the
this is a very
questions. Yeah,
informal. This is a very
yeah.
informal discussion. Don't get nervous. Use my knowledge and interview for your best.
Yeah,
Okay.
I definitely will. Okay, so I guess my first question is, how did you become interested in One Health and veterinary public health in general? Like, how did you become interested in this line of work?
I'm just explaining you. Actually, I studied veterinary medicine in Ukraine. Okay. I studied only 1 year Bachelor of Veterinary Science in India. After that, I went to erstwhile Soviet Union. Okay. Then I studied my veterinary medicine in Kharkov, Ukraine. It is called Kharkiv right now. Okay. So I have graduated from there. Actually, when I was a student of fourth year, okay, then I was properly taught about epizotology. In Russian, epidemiology is called epizotology. Okay. So I have very good teachers. So one day, you see, we were working in the clinic in Kharkov, and a farmer came to the clinic, and he told us that almost before 7 8 days, his son was bitten with a stray dog.
Oh man.
Okay, so after that, for last 24 hours, his son is not feeling well. He has some
Oh.
respiratory problem and restlessness like this. So he brought his son to the clinic. We took the case history properly under the guidance of our head of the department, episodology, and we found that the boy has developed the symptom of rabies.
Oh man.
Okay, and after 2 3 days, the boy died.
Oh man.
So you see, I started taking interest about zoonotic diseases at that time. Rabies is called Beshenstva in Russian. Okay, I'm very fluent in Russian.
Oh, that's cool. I'm actually trying to learn it right now on Duolingo, but I'm not. I only know like hi, how are you sort of stuff. But
I speak four five
oh, that's
languages.
pretty
You see.
cool. I mean, because
Mhm.
well, most people I talk to from India do know at least like multiple languages because it's such a multilingual country. But I imagine you also learned like Russian and Ukrainian as well.
Yeah, 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 yeah.
That's pretty
Um,
cool.
uh, no, I can understand Ukrainian, but I cannot speak Ukrainian properly. I can understand. I can read. I can understand. Very recently, I have been nominated as a editorial board member of Ukrainian Journal of Veterinary
Oh, that's
Biotechnology.
so cool.
Uh, just before 3 4 days.
Oh, that's so cool.
Yeah. So actually, from that day, I started taking interest properly that how the disease is communicated from animal to human being, and what type of diseases these are. They, and it is actually at that time the term zoonotic disease is not known to me. Okay, because we studied all the subjects in Russian language. It is called zonoznoye zavolevanie in Russian. So after that, I started asking my teacher that how the boy died. He then started explaining me that rabies is a dreaded disease and it cannot be cured.
Oh man.
It can be prevented. It can be prevented if the boy was bitten by the dog. If within 24 hours the boy is properly vaccinated and the wound is properly managed, then he can be alive. But as because they did not do anything, and when the infection spreads to the
Oh
brain,
man.
basically, it cannot be. There is no treatment. It is a there is no cure of rabies. You see, uh, since then I started taking interest about zoonotic diseases and veterinary public health. You see, so this is the first incidence.
Okay. Yeah, that I mean, I can't imagine what it's like watching somebody die of rabies. Like
Uh,
I don't, just thinking about like what that boy's father must have been going
no,
through, and it.
actually, actually, I'm just explaining you that I have seen rabies patients in Russia and in India also. In India, I have extensively worked with rabies for
Oh
a very
man,
long time.
yeah.
So I used to visit isolation wards of
Oh
rabies
man.
both in Calcutta and in Delhi.
Oh man.
When I was pursuing my Master of Veterinary Public Health in All India Institute of Hygiene and Public Health, Calcutta, under the University of Calcutta, that is the oldest public health school in Asia.
Oh
Okay,
really? That's pretty cool.
under the school was established under Rockefeller Foundation.
Oh.
Okay, okay, that is one of the best public health school in Asia till date. I did my post graduation in veterinary public health from there. Okay, at that time I had been assigned to work with rabies clinic. You see, that is a isolation ward in infectious disease hospital, and you see, it is very difficult to watch the patients.
Yeah.
They usually tied
Oh man.
with rope, and they are shouting like anything. They are restless. They wanted to break
Oh
all these
man.
things, and it is very horrible. If you cannot watch more than 5 minutes, you cannot watch. It is very difficult. But we had to watch because we had to take the symptoms and other things. You see, we had to
Yeah.
note down and we had to submit for the coursework. So that is why I was compelled. Uh, it is a very dreaded disease, but
Yeah.
it is a preventable disease.
Yeah.
You see.
I one thing that I definitely feel like doing my research on rabies is that it makes me feel hopeful because this is a disease that in many parts of the world is being conquered, and even in places where it's still a problem, the story that I've got from my research is that there's a lot of progress being made. So one thing I keep seeing in my research is this rabies 0 by 2030 project. Have you participated in that movement or that project, and how have you put it in place in Delhi where you were working?
Yes, yes, absolutely. Actually, I was the nodal officer of zoonotic and infectious diseases in Animal Husbandry Department, Delhi. Okay, Delhi is the capital of India, and I was responsible for all type of zoonotic diseases and infectious diseases originated from animals. So I was assigned to prepare the state action plan of rabies along with one junior veterinarian. We work together. Basically, this is my brainchild, and I involved environmental department, medical department, municipal corporation, each and everyone under one roof, and we prepared the state action plan, how we will act to get a rabies-free Delhi in 2030. So I prepared it and I submitted it, and in 2023 it has been accepted by our Ministry of Health and Family Welfare. Basically, I'm just informing you that in 2021, National Rabies Control Program has been started in India. And I was one of the domain expert from animal health side
That's pretty cool.
in this national program. Okay, I contributed a lot for this program. Okay, from animal health side.
That's pretty cool.
So,
Let's see. So many of my audience members live in regions where rabies is controlled thanks to the very hard work of ongoing public health campaigns. Like, people, it's not gone. It's still here. And if as soon as, they slip up in the United States and stop doing it, it's going to come back. But but a lot of people who are in my audience probably don't have any firsthand experience with this disease. And we've talked a little bit about the human impact of people who are, that it is a horrible way to die. But for people who don't have a firsthand experience with rabies and who maybe think of it as something that's under control, why is this disease important? Why is it still important for us to, be dedicating time, energy, and tax dollars to it?
No, you see, actually, rabies is a very complex problem. It cannot be considered only a clinical disease. It is a social disease also. It is a community-based disease also. Because if you are analyzing the situation, clinical situation and dog bite cases throughout the world, you will find out mostly, sorry, the poor people and uneducated people are mostly affected. According to socio-economic status,
Yeah.
if you are analyzing that, you will find out that people who are not very educated and who are very poor and do not have much idea about the disease, they are suffering much and they died
Oh man.
mostly. Why they died? Because they do not have adequate knowledge that one small scratch or one small bite can transmit the virus to the human body. That is a problem. And we know that if the timely intervention is not taken place, what is timely intervention? That if you are bitten by a dog or a cat or a monkey, the wound should be very properly cleaned. Okay. You should put your wound under running water. You should use strong soap. Okay. Alkaline soap, strong alkaline soap, or in spite of using any disinfectant, it is always advisable to wash with a strong alkaline soap
Okay.
through which we are washing our clothes. Okay. Under the running water.
So
So
not
if
like
you were
just not like hand soap, like get like laundry detergent or
Yes,
something of that.
detergent is also working.
Okay.
Detergent is also working. Basically, I mean that this soap or detergent should be
Okay.
strongly alkaline. Okay,
Okay.
because they will change the pH of the wound.
Okay.
Okay, and it is easier to eliminate the virus, and simultaneously the running water should be there. Okay, so it will be easier to manage the wound. And you see, actually, if the wound is very deep, then you need to manage the wound in a different way.
Okay.
You need hyperimmune sera,
The
rabies
hyperimmune serum
rabies
is
immunoglobulin,
which is
rabies
the which is
immunoglobulin.
the which is the vaccine.
Yes, you need rabies immunoglobulin for
Okay.
the local wound,
Okay.
and simultaneously vaccination. Vaccination 0 day, 3 day, 7 day. Earlier it was 0 day, 3 day, 7 day, 14 day, 28 days, even up to 90 days. But right now the World Health Organization is propagating the uh, vaccine for 0 day, 3 day, and 7 days. Okay, it is a subdermal vaccine, intradermal vaccine. So, if we are intervening in a proper manner, timely intervention is done, then there is no problem. There is no problem. There is no death. Okay. The main problem is awareness. Uh, if, as an example, I have seen it in some part of India that people are very reluctant. If they are playing with the dogs, the kids are playing with the dogs, even they are getting the scratch, but their parents are not very aware about it. So
Yeah.
we went there and we teach them. We give them IEC material, information, education, and communication method. You see, we use it. And that is why I have told you that rabies is not only a clinical disease, it is a community disease also. So this is the thing.
So I feel like what we just went over is probably one of the most important things that my audience is going to take away is if you get even a small scratch from an animal that could be carrying, you even if the animal appears healthy, the most important thing is running water, cleaning the room with running water, strong alkaline soap, for at least 15 minutes and then seeking medical care on the same day.
Yeah. Vaccination should be within
Yeah.
24 hours because you see, vaccine is running very fast through your neurological system.
Yeah,
So
because
if the vaccine will reach your brain, then nothing can be done.
when the virus reaches your brain, because the virus
Yeah.
travels up the
No,
nerve
sorry,
cells.
virus, not
Yeah.
vaccine. But if the virus is transmitting to your brain, then nothing can be done. You
Yeah.
cannot control the disease.
Yeah.
Okay, so you have to be very careful for vaccination procedure and wound management procedure. The
Yeah.
two things are very, very important to control the rabies. Okay, so that is very important.
And I also want to reflect back on what you said, that was really important, that this isn't just a disease that it's not just for doctors to worry about at the site of the clinic. This is a community disease, and it
Yeah.
involves the entire community. It involves public health agencies. It
Yes.
involves awareness. It involves veterinarians, doctors, and parents caring for children. Because most rabies victims are children, or at least a very large portion of them. So, and this is a disease of that's a social justice issue too, because a lot of the people who are most strongly affected are people who maybe don't have the best health education, and also they're not as able to get their pets into veterinary care. So there's multiple different aspects of this disease that it's not we often think of healthcare as just being doctors treating patients, but it involves the entire community, and that's kind of what the One Health movement is about.
Yeah, absolutely. Actually, when I can proudly say that when we have prepared the National Rabies Control Program document, it is prepared and it is a optimum One Health document,
Yeah.
considering all the segments who are involved in rabies control.
Yeah.
We have involved medical department who are providing the anti-rabies vaccination to the human being and wound management like this. We have included veterinary department who are responsible for animal birth control program and anti-rabies vaccination program for stray animals and pet animals both. We have involved environmental department and forest department for watching the sylvatic cycle of rabies. You see, the sylvatic cycle of rabies is very dangerous,
Oh yeah.
and due to the wildlife human interface or wildlife livestock interface, the sylvatic cycle is transmitted through human civilization, through livestock, or through direct fox bite or monkey bite like this. You see,
So in
so
oh sorry. So
si-
so
another
go ahead.
things I'm just telling you, we have involved the community very closely, community and educational institutions like schools. Okay, initially when we started working with the community, as an example, in our country, the ABC, animal birth control responsibility belongs to municipal corporations. So municipal authority should be taken care of also. Okay, they have to be your part. So a whole team, when we are going to the community, in initial stages, we have seen that people are not aware about rabies. They are very reluctant. They are very reluctant that we are coming there, we are catching their stray
Oh
dogs, we are
man.
vaccinating them, we are neutering them. So there are a lot of resistance. But gradually, we have taken them into confidence. Okay, we started working with them, and we again and again we are using posters, we are using leaflets, we are we are using some audiovisual aids that how the rabies is creating problems for human being, and it is an uncurable disease. So prevention is better than cure.
Yeah.
So this is the thing. This is the thing. So that is why I use rabies as a social disease also. So you must involve the community.
Yeah.
Until you win over the community, you cannot control the dog population, and you cannot carry out the proper vaccination campaign for stray dogs, for pariah dogs. Okay.
So what I'm hearing from you is that that community involvement is really important, and that's actually one of the questions that I had on this list. Is how do you get buy-in from local communities, and what is you're saying that at first you're encountering some resistance from the general public for like what you're doing, but then as people
Yeah.
learn more, they become more participate. They become more willing to participate. So what are some of the strategies that you've done to get buy-in from local communities?
What I have done, I can share you with you.
Okay.
This is very interesting. This is very interesting. When I was posted in a very uh, posh area in Delhi, okay, in South Delhi, it's a very posh area, and a lot of who's who people are living there.
Yeah.
Okay, so what I did, I started communicating with a resident welfare association. In every colony, there is a resident welfare association who are managing the civic issues. Okay. So I started communicating with them, and I started asking them that we are providing free anti-rabies vaccination campaign. So we wanted to vaccinate your community dogs like this, like this. So initially they did not understand that why this campaign is taken around. Then gradually, I started talking with the community leaders. I identified the community leaders and I started talking with them. And I made them convinced that this is absolutely essential because their children are playing with dogs,
Oh
their
yeah.
children are going to school. So anytime there can be a case of dog bite.
Yeah.
So to avoid this, all the dogs should be spayed and vaccinated. Okay. So that is absolutely necessary from public health point of view. So gradually, they won over. Not
Yeah.
not in a single day or in a
Yeah.
single month. Year by year, we are working with them. Then simultaneously, our municipal corporation is taking a lot of initiatives. They have established a lot of animal birth control centers with the help of non-government organizations, NGOs. Okay, where they are taking the dogs from different communities, they are spaying, okay, neutering, and they are keeping the dogs for 5 days as a post operative care. After that, they vaccinate the dog and release the dog in the same area from where the dog is caught. Okay, so these things are there, but there are other problems for actually the main problem in India, in my opinion, it is population control, dog population control. Uh, you see, I have developed some model for dog population control in respect of actually I had one researcher in University of Ghent, Belgium. Um, she is basically from Ukraine, and I worked with her. She's a very good public health researcher. So actually, we have developed some model type of things which we have recommended to Government of India, and Government of India agreed for that. Actually, what we have recommended, we have recommended cluster-based vaccination.
Plaster based
Cluster-based
cluster.
vaccination.
Okay.
Cluster. You are identifying a cluster. Maybe it is a municipal cluster. Maybe it is a clustering locality. Whatever may be the demarcation mark, there are different understanding in different country. In our country, it is a municipal ward. Okay, we are taking a municipal ward as a cluster. Okay. Actually, World Health Organization has a recommendation. World Health Organization very clearly explained that if you are not able to neuter 70% of the dogs uh, simultaneously for 5 years and not able to vaccinate 70% of the dogs of a locality for 5 years, rabies control cannot be done.
Yeah.
Okay, so that is why what we did and what we have been doing right now, we have identified cluster. As an example, we have a veterinary hospital. Okay, I'm just giving you an example.
Okay.
Uh, Maybe in and around 5 kilometer of the radius, we are taking as a cluster. and we are identifying all dogs in this particular cluster, and we are taking them, we are neutering them, we are vaccinating them, and we are releasing them. Okay, so we are maintaining a database, right? We are maintaining a database because the dog catchers are working with municipal corporation. They are catching the dog and they are maintaining the database, and they are supplying it to us.
Okay.
And so that we are also doing dog survey to understand the tentative population of the dog. So if we are getting the tentative population, then we can fix the target
Yeah.
that up to this date we have to catch that much of dog, 70%,
Yeah.
and doing neutering and vaccinate, release them like this. Actually, you see, earlier also, right now also in some of the states in India,
Yeah.
we are using CNVR method. What is CNVR? Do you have any idea?
No, I don't, unfortunately.
CNVR is catch, neuter,
Oh,
vaccinate, release.
okay. Yes, I do. Okay, I
This is
have
a
heard
this
that
is
before.
a
I just
very
never heard the
yeah. This is a
abbreviation.
very common method throughout the world, and
Yeah.
it is strongly recommended by World Organization of Animal Health also.
Cause like
Okay, wow.
in the United States, people are familiar with that with cats. Cause you'll often see stray cats that have their ear clipped because it's been catch neutered,
we
vaccinated, and
we are
released.
what we are doing, we are basically clipping the ear. When we are doing the neutering operation, we are clipping the ear of the dog so that easily it can be identified, and we are giving the collar, dog collar. Every year we are changing the color of the collar. So
So
as an
we know.
example, blue color is meant for 2024. Okay. If I can see a dog with a blue color, I can easily identify that the dog was neutered in 2024 and vaccinated. Okay. Like this. After that, maybe red color or maybe green color. We are dividing it like this for identification purpose. And right now, actually, we have recommended microchipping of the
Oh
dogs,
yeah.
and the recommendation has been approved by the
Oh, that's
government.
cool.
Okay,
Yeah, that'll
and
be good.
we are getting good money uh, from international organizations also
Oh,
for
that'll be
rabies
good.
rabies control,
That'll be good.
and even we are getting good money also from pandemic fund also. So through this, we are trying to do the microchipping. We are having our own resources, so we are raising the resources for microchipping. Microchipping is very effective. If you can do the microchipping for the dog, the lifelong the dog will carry the microchip.
Yeah.
Okay, and all the informations are encoded in the microchip. If you are bringing the dog and scan the ear, okay, with the microchip, with the decoding machine,
Uh huh.
you will get all the result. When the dog is vaccinated, when the dog is neutered, every data will be coming out. So that is the most scientific method. Sometimes, sometimes in some countries they are using RFID tag also. Okay, so these are the methodologies through which we are trying to solve our problem. But it is very difficult. It is very difficult because, especially in Delhi, the situation is very difficult because the problem is maybe there is a controlled housing complex. Okay, but across the road, mm, people are living in a very scattered manner. So, especially in housing complex, it is easier to catch the dog and vaccinate. But if people are living in scattered manners, then it is very difficult to visit door by door and catch the dog and vaccinate, because the dogs have free access, okay, to run here and there, and they are very clever. They are very
Yeah.
clever. They understand whenever we are
They're
visiting. They are
probably a
understand.
lot smarter than like your typical like pampered indoor dog.
Yeah, yeah. So this is the thing. Actually, whenever you are approaching to the dog, you must win over the psychology of the dog also. You must understand the psychology, and you should temper them
Yeah.
properly. You should give them biscuit or some
Yeah.
feed, dog feed like this, you see, so that they can understand that this fellow is not your enemy.
Yeah.
Okay, so you must have a compatible relationship with the dogs.
So you're not only
As an
winning over
example,
the human community, you're winning over the dog community
yeah,
too.
yeah. Actually, I I practiced veterinary medicine for more than 30 years as a clinical veterinarian. Okay. So it was my job. It was my job to work as a clinical veterinarian, and most of the part of my job I dealt with dogs. Okay. So I can easily understand their
Yeah,
psychology.
I love dogs. I really do.
I also love dogs. I
Yeah.
also love dogs.
So I'm glad to
This
hear
is
that
the
there's people in India taking good care of them.
yeah, yeah, yeah.
Um, let's see. What is my next question? So India has made a lot of impressive public health strides in recent years, such as, elimination of polio, dramatic reduction of maternal mortality. However, India is the country that is probably most strongly affected by rabies today, or at least one of them. Um,
Yeah.
and which is why it was important to me to actually seek out somebody from India to talk about for the rabies project. I'm just wondering, in your opinion, what are some of the challenges that Indian public health workers face when fighting rabies that maybe isn't
Yeah.
doesn't occur in other parts of the world?
There are a lot of challenges. There are challenges like intersectoral coordination. You see, poor intersectoral coordination. Data sharing. Data sharing. Sometimes you see we are working in silos. As an example, the veterinary department is working in silos. The medical department is working in silo. The municipal corporation is working in silo. So sharing the data is very important
Absolutely.
for taking some decision or for making some decision. Okay. But sometimes you are ignorant about the data, what is generated in medical department or in environmental department or in municipal corporation. As an example, I was working with veterinary department. I have generated data. So after that, what we started realizing when we established the National Rabies Control Program in 2021, we started realizing that we must share our data on regular interval. Okay. So we established under National Center for Disease Control. It is under the Ministry of Health and Family Welfare in India. We established a portal where we are sharing data.
Oh, that's
We are sharing
cool.
data so that we can access the data that how much dog is neutered, how much dog is vaccinated, like this. Okay. So, but still now miles to go about it
Yeah.
because data sharing is a very important thing, and because
Absolutely.
right now you see all the things are data driven.
Yeah.
Even not only in rabies, in case of other zoonotic diseases also
Yeah.
things are data driven. If you are not sharing data, then it is very difficult to prepare the risk assessment and risk management. Okay.
And none of that is meant to disparage India at all. I feel like there's a lot of really positive things happening from what I've read about your country. I'm not saying that as a means of disparagement. I was just curious about how rabies specifically was manifesting there.
You know, actually, there are a lot of good things happening in India right now
Yeah,
because
absolutely.
in different states, uh, the medical department, the veterinary department, and the municipal corporation, they really started working together
Oh, that's
under
good.
one umbrella because they understood that if they are not sharing their responsibilities with each other, it is not a one man's game.
Yeah,
Rabies eradication is not a one man's game. It is
for
a
real.
team game. It is a team game. When you are united, then you can win. Individually, you cannot win the situation. So
Yeah,
there are a lot of very good and very outstanding works are carried out in
I
different parts
absolutely.
of India, starting from our northern state, Himachal Pradesh, then our western state, Goa, southern state, Kerala. They are doing very good work regarding rabies control and rabies eradication. They are
I'm
doing
glad to
very
hear
good
that.
work because it is a sustained effect and collaborative effect.
Yeah.
If it is a collaborative effect, only then you are in a position to control the situation.
I feel like that's kind of a theme that keeps coming up in our conversation is the importance of you can't just it's not a one facet problem. You have to involve lots of different people. You have to involve the whole community. You have to see things from a social perspective, and you have to involve lots of different people in order to solve the problem. And I feel like that's a theme that's coming up multiple times in our conversation so far.
Yeah, actually, one thing I will tell you that if you are analyzing the disease situation, what it was earlier, as an example, what if you were considering it, what it happened before 20 years or 25 years, and how we are doing it in India right now, there are significant differences. And moreover, one thing I would like to thank the animal welfare activist groups.
Oh
You see,
yeah.
there are a lot of animal welfare activist groups in India who are taking a lot of initiatives for rabies eradication, and some of the international organizations like Human Society International, then uh, Free Rabies, like this. There are a lot of international organizations who are involved with us, with government department. They are working in different parts of India, and that is already a collaborative method. You see, collaborative method. That is a One Health approach. I can
Yeah.
tell that that is a true One Health approach, and
For real.
everybody is sharing their responsibility, and a lot of good work is done in grassroots level also. Very appreciable.
That's so nice to hear. I'm really glad to hear about that, and it's and like I don't know, I really do like hearing about like the animal welfare activists getting involved because as I said, I love dogs and it is really cool to hear about how we can conquer this problem by if we care about the community, if we care about the environment, and if we care about the animals all together, that is beneficial for everyone.
Uh, you see, as a veterinary public health expert, I can tell you that if you are not compassionate for the cause of animals,
Yeah.
you cannot control rabies. If you are very rude, if you are very rustic, if you are very restless or not passionate for the cause,
Yeah.
then rabies control cannot be done.
Yeah.
You have to have patience. You have to understand the psychology of community people. You have to understand the psychology of the stray dogs,
Yeah.
community dogs. Only then you can prepare a good strategy to eradicate the rabies, to control the dog population also. Actually, whenever we are talking about the control of rabies, animal birth control is playing a very significant role. A true animal birth control process should be implemented.
Yeah.
Okay, 70% dogs should be neutered and vaccinated simultaneously for 5 years, and dedication, proper dedication is required
Yeah,
for
it
this
has to
work.
you have to keep it up
Mm.
over the long term.
You have to start your work from the ground level. Okay,
Yeah.
only then you can succeed. Otherwise, not. And the situation is not very easy. It is complex, and sometimes the situation is getting worsened because of this multi-sectoral approach also. You
Yeah.
see, because everybody is having their own opinion. So sometimes you see, they have significant differences. So uh, one thing you must remember: you are you are working for the society. You are working for a cause. If you can understand that you are working for the society and you are working for public health cause, only then you will forget all this quarrel, all this misunderstanding and other things, and you shake your hand, you go further. Okay.
So let's see. So okay, we talked a little bit about building up coalitions between different organizations and groups. So a very big aspect of in the public health business we often use the term engaging multiple stakeholders. So what lessons have you learned in your work on rabies about building coalitions between multiple stakeholders for a campaign? You talked about animal rights activists. You talked about different aspects of the municipal government. You talked about veterinary clinics and building up trust with the local community. So what lessons have you learned in that regard that other public health workers can take home from this conversation?
Yeah, actually, one thing I will tell you that is community education.
Yeah.
Okay. Community education and social and behavioral change campaign. These two things. When I was taught public health, I was taught health education very properly. My teacher who taught me in Calcutta, she's an internationally famous health education expert. She worked with the WHO, she worked with UNICEF and other things. She taught me this health education portion.
Yeah.
So two things I will tell you for the society and for the public health workers. One is very strong IEC campaign, information education communication campaign. You should use good leaflets, good posters, good banners, then audiovisual videos, then communication talk. And in my opinion, I am working with schools, with school children. Okay, I used to visit school and I teaches them about the danger of rabies, about the dreadfulness of rabies, like this, you see, and how they will behave with stray dogs. I'm also teaching them. This is very important when you are working with community. Not only you are working with the parents, but also you should work with the children.
Yeah.
You must make them aware how they will behave with the stray dogs. They should not be afraid, you see, but how they will observe the dog and how they will understand the dog is aggressive, so that they should avoid the dog. These type of things should be properly mm, taught, properly communicated, and you are using IEC material for that. Number two, you see, social and behavioral change campaign. That is very important. When you are working with the community, then the community people may not be understanding the risk of rabies, or uh, it is a mixed community. You see, there will be some people who are loving dog. There are some people who hate dogs. So you have to identify your strategy
Yeah.
for social and behavioral change. Okay, you must prepare some campaign for social and behavioral change, so that the total community will become compassionate uh, towards the causes.
Yeah.
Okay, towards the dogs, they should not be very harsh unnecessarily. They should not beat the dogs. If they are beating the dogs, the dog will be angry and the dog will become aggressive and they can bite.
Yeah.
So you must, as a public health worker, you must teach the community people about it. And for that, you take the help of IEC material. You you demonstrate some methodology, okay, in front of them, so that it will be more interesting. Sometimes you see, we are organizing some camp and we are showing the common people how we are vaccinating the dogs, how we are fixing the dogs, how we are vaccinating the dogs, like this, how we are putting the collar. That is also very interesting. You see, this is a mass awareness. This is a mass awareness. You make the people aware about it as a public health worker. This is your responsibility, you see.
Yeah.
So, overnightly, nothing will change. Gradually,
That's true.
gradually, you have to work. And almost my whole life I have devoted for this type of zoonotic diseases.
It's a good thing to devote
I'm
your
a
life to, that's for sure.
You see, actually, I used to call my friends used to call me man of zoonosis.
Oh
Okay,
boy.
zoonosis doctor.
Oh.
They used to call me. So because always I'm trying to do something better for the society through zoonosis control. So like this, you see.
Yeah.
So these are my findings about this disease. So it is a very complex disease. It is not so easy to
Yeah.
control. A sustainable effort not only from the community but also from the municipal corporation, local government, the veterinary institutions, the medical institutions, the environmental experts, even the economist, the sociologist also, they are playing significant role here
Yeah.
also. So, in my opinion, you must involve the sociologists here who are
Yeah.
studying the social aspects, social
Yeah.
behavior also.
Yeah. I think you and I
So
talked
when you
about
were,
that a little bit before, about how important it is to involve sociologists in public health work.
yeah, yeah. Because you see, when we are chalking out a big One Health program, we must include sociologists and economists there.
Yeah.
Okay, because we are always analyzing the impact, social impact of the zoonotic disease and the disease burden, you see,
Yeah.
economic burden. So we are calculating all these things right now. So simultaneously, you see, rabies is a disease where lot of money should be invested for vaccination, for spaying. So you must include some economists or some sociologists in your team, in my opinion.
That's good advice, definitely. So another good aspect of any solid public health campaign is collecting data after the fact.
Yeah.
So what data do you guys collect to know if your campaign is working?
Hmm. Yeah. How we are collecting data? Actually, we are doing mass campaign, and we are collecting data from the people. As an example, people are coming with their own dogs. Okay, so we are taking their name, their address, their mobile phone number, and the date of vaccination. We are preparing register. Simultaneously, when we are covering a community, then we are counting the dogs, how many dogs we have captured, how many dogs we are vaccinating. Okay. And we tried to identify that how many proactive people are there in the society where we are doing a camp, as an example, anti-rabies vaccination camp. Maybe there are 50 people, but it is not obligatory that all the 50 people are proactive. They will be having a helping attitude. Okay, so we are trying to identify, because in next time when we are coming, we are trying to make a contact with those people who are not so proactive, who are a bit reluctant, who are a bit withdrawing like this. For that, psychologists also play a role, you see.
Yeah.
Clinical psychologists, they can also identify that what is the cause, why they are afraid of the dogs, like this, so many
Yeah.
things, because this is a very complex thing, not so easy. So we are collecting all sort of data, how much vaccines we are, how many doses of vaccines we are providing in a particular area. Then after 1 month we are analyzing all the data. The data analysis has been done and it has been forwarded to higher headquarters. Okay.
And you've emphasized that data sharing is also extremely important between different data sharing between different sectors of the government and public health workers.
Yeah, absolutely. As an example, if there is a dog bite, if there is a dog bite, so it is the uh, obligation of the human health department, the public health department, to get the data that where the dog bite took place, at what time the dog bite took place, how many dogs are there like this. These all data should be taken, okay, from the person who was bitten, or from their from parents. Okay, and these data should be shared with the veterinary authority, so that the veterinary authority can visit this place, catch the dogs, get them neutered and vaccinated. Okay, because until you are not sharing the data, the campaign will be incomplete.
Yeah. Do you believe that your work has succeeded in reducing number of dog bites or number of rabies cases?
You see, this is a teamwork. This is not an individual work.
Yeah.
Maybe I acted as a team leader. Maybe I acted as a team leader.
Well, you plural.
Definitely, yeah. I acted as a team leader for a particular area in Delhi. You see, so I'm quite confident that definitely we have reduced the dog population and
That's really good
dog
to
bite
hear. That's really good to
significantly.
hear.
Yeah,
Because
yeah.
like that's $1 million question. Like every is it working? And that's the importance of the data collection.
Data collection. Uh, there are a lot of methodologies what you can imply, but the easiest way to get the data, if you are carrying a tab, okay, you enter all the data. There are different apps, okay. If you have these apps, then it is very easier to collect the data.
Yeah.
The app contains the name of the owner, their mobile number, their address, type of dog, type of animal, dog, cat, anything. Okay. So it is very easier to type the data, to collect the data, and get it stored. Okay.
Yeah.
So it is very easier
So,
because nowadays it is very difficult to write in a register or like this. You see, you don't have that much of time.
yeah, nobody's doing
Uh,
it by hand
yeah,
anymore.
yeah. Everything is doing virtually.
Yeah.
Everything is done virtually. So that is easier. You see, if you have internet access, then immediately you can share the data with
Oh,
your
that's
other
good.
departments.
That's good.
Immediately you can share the data. Okay.
Let's see. So what do you think are the main takeaways that other public health workers who are working on rabies control should take home from your successes in Delhi?
Mm,
Like, what do you think are the main things that?
I believe that this is my personal experience. I believe that you must study the situation initially. When
Yeah.
you are when you are going to a particular area and start your rabies control program, initially don't do anything. Initially meet the people, common people of community, meet the community leader, meet the shopkeepers, visit the market, try to understand the situation. Okay, why the stray dogs are roaming, what is the nature of the stray dog, as much as information, epidemiological intelligence.
Yeah.
It is called epidemiological intelligence. As much as possible, you should gather. After that, you analyze it statistically.
Yeah. That's
Okay,
good advice.
these are raw data. Okay, after that, you analyze the raw data and try to come out to a conclusion how you will start your work. Because if you are starting haphazardly, you will not succeed.
Yeah.
Because
Definitely.
one thing again and again, I will tell you that you must have an idea about the dog population in this area.
Yeah.
It may be 100, it may be 120, it may be 125. It doesn't make much difference. But as an example, if there are 125 dogs, you are calculating only 25. It is wrong.
Yeah.
Okay, then you cannot control. You cannot catch the dogs, and you cannot carry out the neutering procedure, surgical
Yeah. You
procedure,
have
or
to have a
vaccination
good,
procedure.
you
Okay,
have to get your
you have
knowledge
to
ahead
have
of
a
time.
you have to have an adequate idea. Not
Yeah.
exactly. Maybe for roaming dogs, it is very difficult to identify the exact number. But there are formulas. If you can go to epidemiology book, you can use biostatistical formula through which you can identify the tentative dog population. Okay,
Yeah, that's good
you
advice,
mm, and another one thing, your logistics. What is your logistical support? How much vaccines do you have? How much manpower do you have to support uh, your campaign? Who will be the dog catchers, from where they are coming, whether they are properly trained to catch a dog? um, because sometimes dog catchers are not properly trained and they are violating the animal welfare law.
Yeah.
So that is very important. You see,
Yeah.
you have to evaluate before starting your work. You must prepare yourself properly and you must gather all this information step by step. Only then, as a public health worker, you can work efficiently.
So I got a notification from Teams that the meeting is going to shut off in 5 minutes. We can start a new meeting if you want, but I feel like we have gotten a lot of the main things that I wanted to talk about. But as one last question, a couple last questions. The first one is, what should my audience do at home to support rabies control efforts? What should
Pardon?
my audience at home do to support rabies control efforts? How can my audience contribute to this project?
your audience, you must identify who are the people working for rabies control.
Mm-hmm.
Okay, initially. After that, they should approach them and they should make a team.
Mm-hmm.
Okay, not exactly they are the public health workers, but
Mm-hmm.
they must be a supporters. Okay,
Mm-hmm.
let them prepare a team. After
Mm-hmm.
that, a sustainable effort should be applied to the society, to the
Mm-hmm.
community. Okay, and one thing I will tell you that maybe today we could not complete all the things.
Mm-hmm.
We can have another one session afterwards. There is no problem. It can be continued. And if you need to get more information about rabies or
Mm-hmm.
other things, you just prepare a questionnaires. You
Mm-hmm.
send me, I'll answer. No problem. We can
And
have the second part of this as a continuation. Okay, our discussion.
and as a sort of a lighter note, if I ever visit India, what should I go see?
If you are
If I visit Delhi
if you
specifically,
are visiting India,
yeah.
Delhi,
If
you
I go to
must
Delhi, what should I go see?
you must visit my home initially.
Oh yeah.
I will treat you as a guest. Okay.
Well, it's good to know I
And
have a.
then I will take you to some veterinary hospitals and ABC center, Animal Birth Control Center, in and around the city, so
Mhm.
that you can have an adequate idea how we are working for
Yeah,
rabies eradication.
maybe pet some
Okay.
dogs.
Welcome to Delhi.
Yeah.
My home is open
Oh, thank you.
uh, because my daughter is in USA. I told you.
Yeah.
She is in San Luis Obispo. She's teaching in California
Hmm.
Polytechnic State University. She's a
Well, good for
faculty of
her.
sociology. Sociology.
Good for her.
I don't know. She was in Virginia Tech, University of
Hmm.
Virginia Tech, from where she obtained her PhD degree last year
Uh huh.
in sociology. After that, she got a job in Cal Poly,
Hmm.
California Polytechnic State University. Right now, she's there. Okay.
All right. Well, I
Mm.
think that's, yeah, definitely we should keep in touch. I don't have any more questions. I feel like you covered a lot of the different things that I was
Mm.
going to ask about, but once again, I really do appreciate your time, and I really do appreciate you coming on and helping with this project. So I
Mhm.
just want to express my gratitude before we sign
No, no,
off.
no. You are welcome. Actually, you see, I have been working with a lot of think tanks in USA.
Mm-hmm. Yeah.
Okay, lot of universities also
Mm-hmm.
in USA. I'm a regular in OneHealth Wednesday.
Mm-hmm.
My friend Ginger Dixon is
Ginger
conducting this
Dixon?
program. Ginger Dixon, yes, she is a friend of mine. So you can have my YouTube podcast.
Okay.
Okay, with her.
Cool.
You search
Uh,
you search in YouTube,
yeah.
putting my name, you will find out the podcast with Ginger Dixon. Okay,
Cool. All right.
so there is a podcast about rabies also.
Okay. Cool.
You will get lot of informations from that also if you listen. It is a 1 hour podcast.
Okay.
And regarding other things, in spite of rabies, if you are interested with other zoonotic diseases or
Mm-hmm.
other public health issues, you share with me. We
Mm-hmm.
can chat.
Yeah.
Okay,
Yeah.
I
It's
have no
good that I
problem
have
because
a.
I love to share my expertise
Yeah.
and my
Yeah.
experience with
Mm-hmm.
youngsters like you,
Yeah.
because you are the next generation and you will have to carry the flag of public
Yeah.
health. You see.
Oh, hopefully, I got some big shoes to. It seems like I got some big shoes to fill. That's for sure.
Hmm.
But I
You are
really do
you are you are
appreciate your
based
time.
you are based in Ohio right now,
Yes, Ohio.
in Kent State
Mm-hmm.
University.
Yeah.
Okay. Actually, one of my friend, he did his PhD in mechanical engineering from University of Ohio, not
Mm.
Kent, but University of Ohio.
Yeah. That's
Uh,
good school.
yeah. He did his PhD in mechanical engineering
Mm-hmm.
long back, almost before 25 years. Now he's working in Germany.
Mm. I have
Uh,
some. I have a family member who married a German person, but I've never been there before. But
okay,
but
I visited Germany a couple
mhm.
of times.
What was it like?
The
What?
language is very
Yeah,
difficult.
it like I listen to it. It doesn't make any sense to me. But
I can't speak German. I can't understand German.
What was it like studying in Soviet Ukraine?
You see, actually, I studied veterinary medicine in India. Okay, when I was a student of first year in a veterinary school in Bengal. I'm basically a Bengali. I belong to Bengal. Right now, I am living in New Delhi, the capital of India. But I originally I'm from Kolkata, Calcutta. Okay, so I got admission in a veterinary school in Bengal. Okay, this is a very famous, world famous veterinary school.
Cool.
Okay, so I studied only 1 year there. It was called BVSC, Bachelor of Veterinary Science and Animal Husbandry. Okay, our degree is called Bachelor of Veterinary Science and Animal Husbandry. When I was a student of second year,
Uh-huh.
actually at the time, Government of India has cultural exchange scholarship program with different socialist countries like Soviet Union, GDR, Romania, Bulgaria, Czechoslovakia, okay, Poland, like this. So, Government of India advertised this scholarship. I applied. I applied and I got selected because I was a good student in my school and in my college. So I got selected for Soviet Union. So at the time, you see, I was only 19 years old. So I was very crazy to go abroad. Everybody was crazy at
Yeah.
the times to go
Yeah.
abroad. So I got the chance, and it is a full funded scholarship
Oh, that's
by the
nice.
government. Full funded scholarship, including the passage.
That's
Okay,
good.
Delhi to Moscow, Moscow to Delhi, and for 6 7 years, everything was taken care of,
Oh, that's good.
including our hostel, including our food, like this. We got a sufficient scholarship in Soviet Union.
That's good.
In my veterinary school, students from 38 countries studied.
Wow. That's so cool.
And I have so many friends from Latin America, then
That's cool.
Arabian countries, then Africa.
That's
Still
cool.
now we are in still now we are in close contact.
That's
I have so
cool.
many friends in Ukraine. I have so many friends in Ukraine. We speak in Russian, definitely. My friends are from Panama, from Mexico,
That's
from
cool.
Bolivia, from Nicaragua, from Chile. They used to call me here from Arabian countries like Morocco, like Algeria, like Tunis, then Ghana, then Sudan, Ethiopia,
Yeah.
then Mozambique. People, but the unique thing is everybody has their own language. I speak English. They speak. Somebody speaks Portuguese. Somebody speaks Spanish. Somebody speaks Arabic. But when we speak with each other, we speak only in Russian language. That is a great thing. Still now we speak very well.
Well, that's good. I'm excited
Uh-huh.
to study more Russian and learn more Russian so I can.
I even last year when I went to Blacksburg,
Uh-huh.
when my daughter was completing her PhD, I have seen some Russians. They are talking to each other. They are
Oh
also
man.
getting the degree. You see, master degree, PhD degree. So I started talking to them
Oh
that
yeah.
how come you are here?
It's
They
so
are
cool like
all
when you learn a
they
new language and you can like join in people's
yeah
conversation and
yeah
stuff.
yeah. They migrated to USA almost before 30 35 years. You see, after the disintegration of Soviet Union. In 90s, in early 90s, they
Yeah.
migrated to USA and they are all US citizens, but still they speak Russian.
Yeah.
So good experience.
Yeah. That's let's see. Look, I thought it was going to cut us off, but it doesn't look like it's cut us off. Is there anything else that you want to talk to my audience about that you think my audience needs
Uh,
to know about rabies in general, about zoonotic diseases, about public health
you see,
veterinary?
I believe that for zoonotic diseases, you must organize another one session. It is not sufficient. It is the
Yeah.
time is up. So for zoonotic disease exclusively, we can establish another one session.
Yeah,
I am
yeah,
ready
we
to.
should we
I
should
am ready to talk
schedule
about it.
I I'm hoping to find a couple more rabies experts to interview and work on this rabies experts, but when it's time for me to talk about some other different topics, I'll definitely reach out again. Unless
Yeah,
you
yeah, yeah. You decide the topic. You tell me the topic
yeah,
just before sometimes so that I can prepare accordingly and I can talk. I have no problem because
yeah. I really
I worked
appreciate
I
this. I really
I
do.
worked with every aspect of zoonotic disease. Okay, zoonotic disease is just like my five fingers.
Yeah. And I
I'm so
think
passionate
zoonotic
about
diseases are
zoonosis.
absolutely fascinating. So I don't know if
Yeah,
I
yeah,
don't
yeah,
know if it
yeah.
makes me a bad person that I think diseases are kind of cool, but but I'm just like, oh, this is so fascinating, you know. But
You might be knowing that 76% of the emerging and re-emerging diseases are zoonotic,
oh,
and
really,
60% of the total human diseases are zoonotic.
oh man. So there's
Yeah,
very few germs that stick to one species.
yeah. Now the species jumping takes place, you see.
Yeah,
And how zoonotic disease spreads throughout the world, it is very interesting. But
yeah,
for that, we must have another one session. I will
yeah.
explain all these things. It will be very, very interesting.
We should have a session where we talk about the sylvatic cycle because that's the name of the
Yeah, yeah.
channel. Um,
Sure.
one more question if we have time to throw it out. Um, one thing I'm learning about is rabies is a conservation issue for endangered species as well as human health and domestic animal health. Do you know if any such concerns have happened in India with like sylvatic rabies? Like, are there any particular animal populations in India that where rabies is a conservation issue?
Mm, except dog.
Yeah.
Because in India, if you were analyzing the data, you will find out that 90%, 98% of the animal originated rabies is from dog.
Yeah.
Rest 2% are from cats and monkeys. Okay.
Monkeys.
Monkey
I
bite,
would not
monkey
have
bite
expected
is
monkeys. But I guess
monkey
if
bite is
monkeys are really
common.
common, then like a common street animal, then
Yes,
maybe.
in actually the jungle is getting vanished right now.
Yeah.
So all the monkeys are venturing into urban area right now. So there is a close human animal interaction, and sometimes the monkeys are biting human being. Okay, so monkey bite, it is a matter of concern for rabies. For rabies, it is a sylvatic cycle definitely. It is a wildlife cycle. Monkeys,
Yeah.
so that is a matter of concern also.
Okay. So the audience knows if you get bit by a monkey, you got to go to the doctor and do all the same
Mm.
things that you would do for
You
a
know,
bat bite
another
or a dog
another
bite.
another one thing I will add, that in Latin America,
Uh huh.
the rabies cycle is sylvatic
Uh
and
huh.
it is transmitted from bats.
Yeah, with the
Okay,
vampire bats, which
vampire
are
bats. Yes,
and like I seen pictures of vampire bats and they look really cute because they have like those little pug noses.
but they are not cute. You know,
No.
most of the diseases are originated from bat. You take Nipah virus. Okay, Nipah virus is transmitted from bats.
I wonder why
Okay,
bats are like that. I wonder if it's because they can fly, so they can.
bats are the storehouses of zoonotic pathogens.
Oh man, I wonder
Yeah.
why. I wonder why bats. I wonder why. I wonder
You
what
see,
it is about bats that makes them.
bats have free access to wildlife.
That's definitely
So they
true.
are, they are grabbing zoonotic pathogens from wildlife, and simultaneously they are coming to human habitation. So they are spreading the zoonotic
And bats
pathogens.
are also very social too, so they're spreading it among each other too.
That is unfortunately
Yeah.
very. It is very unfortunate that bats are very social,
Yeah.
and it is a challenge in front of One Health experts.
Yeah. Yeah.
Okay.
Let's see. Is there anything else that we want to talk about before we sign off today?
I think that we have completed all these things.
Yeah.
Most of the aspects we have
Yeah.
completed. So we can have another one session regarding
Yeah.
zoonotic diseases. I will explain in another
Definitely,
day. Okay.
definitely. I don't necessarily have a strict timeline of when that will happen, but I'll definitely reach out again.
No, you find out your time and you let me know. If I am free, then definitely I will contribute.
All
I have no
right.
problem.
Well, thank you very much. I really appreciate your time today, and
You're
I
welcome.
learned a lot. I think my audience learned a lot, and I'll definitely send you this recording.
Mhm.
Let's see. I just wanted to double check to make sure that it actually had recorded.
Only one request is there, that when you are sharing it to YouTube, okay, for your audience,
Yes.
you share this link with me.
Yes, absolutely.
Mm.
Absolutely.
Okay.
All right. Well, thank you very much. You have a good evening.
Thank you. Same to you.
Yeah, thank
Same to
you.
you. You have a
It's a
good
good
day.
morning for me. Yeah.
You have a good day.
Oh, yeah. Well, thank you. All right. Well, see you later. Thank you.
See you. Keep in touch. Keep
I
in touch.
will. I
You
will.
have my number. You
Uh-huh.
have my number. So you can call me also. If you
Okay.
require, you can call me.
All right.
We can talk.
All
We
right.
can talk.
Well, thank
Thank you.
you. See ya.
Bye bye.
Bye-bye.
Bye bye.